Okay, so I have done all my pre-treatment tasks. I've verified my patient's name and date of birth. I've checked my orders. I have explained my patient the duration and what we're going to be doing. Basically, what we're going to do is try to formulate a cough with our cough assist machine here. I'm going to go ahead, I've plugged up. I'm going to make sure I have all of my materials available. I have my mask, I have my machine, I have my 12 pieces of corrugated tubing here. In real world, this would be an adult patient, not really a child patient. I have my Yonker just in case we bring up these secretions. I have it close by. It will be attached to my suction. So I'm just gonna set this here on the table. What I'm gonna do before I put the mask on the patient is I'm going to go ahead and set up my machine. I'm gonna go ahead and put it on manual. I want my pressure to be between -10 and -20 on expiration, and then 10 to 20 on inspiration. So I'm gonna just turn it on first. And I'm gonna make sure I include the corrugated tubing. And so right about now, we're at about 20 on inhalation. And then, okay, about 20 on exhalation now. So as far as my inhalation and exhalation here, I wanna make sure that it's 1 to 2 seconds. So exhalation is longer, I'm gonna put that one on 2 seconds. And then inhalation, I will put it to 1. I've set it to 1 for inhalation and then 2 for exhalation, since normally we exhale longer than we do inhale. My pause I have set for 2 seconds. So at this point, I'm gonna make sure that my mask is sanitized and get it ready for my patient. What I'm gonna do is go ahead and I will put it on my patient to fit it. I could go ahead and put it to auto to go ahead and try to mimic inhalation and exhalation. I have pause again for 2 seconds. I'll do this, I'll set it up how it's supposed to be set up, but also I want to notate my patient's normal breathing pattern. So that way I can make sure that I'm able to readjust the machine as needed, make sure that it's comfortable for my patient, make sure that I'm notating how my patient is responding to the therapy. Again, I have my Yonker here just in case my patient coughs up any secretions. And I'm gonna do this for about 4 to 5 repetitions. I'm gonna pause again for 4 to 5 cycles, pausing for 20 seconds in between, and then I'll do 4 to 5 repetitions of those cycles. If I were to do a mouthpiece, then I would instruct my patient to either hold his nose or use nose clips. So at this point, I will notate everything and chart everything for my patient. I will clean up any supplies that I may have brought in. I'm going to turn my machine off. I'm going to position my patient for comfort. I will thank my patient. I will also notate my patient's vitals. Just do all of my post-treatment tasks all together, and then I will leave.